Caught me. My name is Wilhelm Ellsbury the First. More to come. And today on Master PT Roundtable, we have an international cohort of intelligence. My first guest is none other than Niles Standish. Niles, tell us something about yourself.
Well, Wilhelm, it's a pleasure to be here. I'm from England, and my area of expertise is pediatric athletics.
Interesting.
Quite.
And my other guest is Spencer Billingsley, all the way from the United States of America.
Hi, Mr. Wilhelm. It's a real pleasure to be here. Real pleasure.
Awkward,
Real pleasure.
really.
Real pleasure.
Niles, I understand that you've brought a video clip to help demonstrate some knowledge.
Yes, I brought a video clip in of some American children playing American football and the dangers that go along with it as far as concussions go.
Okay, now it is on. Peter Johnson! A monster hit!
This was a dogfight.
Hit the guy!
Dunbar Lewis Kane inflict.
Deplorable.
Violent. Very, very violent.
Despicable.
So what exactly is a concussion?
Well, Mr. Wilhelm, a concussion. The simplest way I can describe what a concussion to you is that when you have a violent hit, much like you saw in the video there, it actually results in a bruised brain, and actually you lose consciousness.
Other symptoms may include a headache, dizziness, and loss of cognitive ability. Those with symptoms present 2 days after a concussion are 10 times more likely to develop retrograde amnesia.
So how do concussions relate to high school injuries?
Well, roughly 10% of all high school injuries involve concussions.
Well, Mr. Niles, actually it's 8%. 8% of all injuries.
Like I said, roughly 10%.
Well, Mr. Wilhelm, if it's okay with you, I'd just like to mention that in 2003 I was published in the Journal of Pediatrics, and we compared high school athletes to college athletes, and we actually found that high school athletes had longer prolonged memory dysfunction when compared to college athletes, and we concluded that extra care should be taken before returning high school students back to their respective sports.
Well, since we're spatting proverbial research, I was published in the British Journal of Sports Medicine in 2009, and my study found that women were more likely than men to have a concussion.
That's very interesting, Mr. Niles.
Very interesting indeed. Quick question. How good looking am I? Never mind. Moving on to our next topic. Overuse injuries of the elbow.
Wow, look at the torque on that young lad's elbow. He'll be in physical therapy by high school. Did you know that elbow injuries are the most common injuries in youth baseball players?
Well, Mr. Niles, actually I did, and actually one study found that up to 25% of youth baseball players actually complain about elbow pain in 1 year.
Well, growth plate injuries are more common in youth baseball players, and ligament injuries are more common in adult baseball players.
Well, actually, Mr. Niles, the valgus force acting on the anterior-posterior axis of the elbow actually results in a distraction force in the medial structures, and a compression force on the lateral structures, and actually that is one of the most common causes of elbow pain in most throwers.
Well, that's all the time we have here today on Master PT Roundtable. I hope you'll join us next time for a rousing discussion. Our topic, the pelvic floor. Thank you, gentlemen, for coming.
Thank you.